Hello and good evening, everyone. Welcome to our Co-Vaccine Chronicle webinars presented to you every Sunday 6 p.m. I would also like to wish each of you a happy Independence Day on behalf of Docplexus. So, Co-Vaccine Chronicle webinars have discussions on the trending topics associated to COVID-19 in India and globally. For today's session, we are trying to see the global disease burden with respect to COVID-19 on the healthcare systems. For this, I am pleased to introduce our speaker for today, Dr. Damodar Bachani. Dr. Bachani has more than 40 years of professional experience in teaching and 24 years in program management in Ministry of Health and Family Welfare in programs relating to blindness, disease surveillance, HIV/AIDS, and NCDs. More than 130 publications in various national and international journals, and large number of technical reports and guidelines. Dr. Bachani was formerly the Director and Professor Head in Community Medicine, Lady Hardinge Medical College, Deputy Commissioner in the Ministry of Health and Family Welfare, Government of India. Currently, Dr. Bachani is the Deputy Project Director, John Snow India, for Building Health Cities project funded by USAID in India, Indonesia, Vietnam, and Nepal. He has been associated with many organizations, including ICMR, NHIFW, Indian Cancer Society, IIHD, and other public health associations on an honorary basis. We would like to welcome you on Docplexus, sir.
Thank you.
So you can start your presentation.
All right. Thank you for inviting me on this important topic. But before I begin, happy Independence Day to all the citizens of this country, this great country. And it's a very relevant topic, COVID-19. But at the same time, I am looking at this particular pandemic as an opportunity to strengthen the health system. So my focus would be to share with you the global disease burden in general, particularly from the other disease point of view, and how after COVID things have changed or are likely to change in future. And then, of course, I will focus on response of the healthcare system due to COVID-19 pandemic, mainly in India, but globally also. On the negative side, there were many challenges that were faced by a vulnerable population, mainly in the developing countries, so we'll talk about it. And long-term impact of this pandemic on economy, society, politics, technology, and sustainability in future. Let me begin with the global burden of disease. We have seen that since 1990, the last 3 decades or so, things are changing, or rather were changing very nicely. We were conquering communicable diseases, the mortality due to those diseases, as well as the burden of those diseases. Even in a low economy nation like Afghanistan, you could see that change was quite significantly visible. In India also, we found that these total burden of disease is going down, as is in the other developed countries. But there were many countries which were facing more problems, like most of African nations and some of the Asian nations were worse off compared to other developing nations. If you look at the number of deaths by cause, cardiovascular disease had the maximum share globally, as well as in India also we find that roughly 1 in 4 deaths occur because of cardiovascular disease. This was followed by cancers, which are on the rise. Respiratory diseases, particularly chronic obstructive pulmonary disease, was another important cause of deaths. If you see this picture about 30 years back, perhaps the communicable disease would have been the major causes. These are followed by other diseases, mainly non-communicable. But look at tuberculosis and HIV/AIDS and malaria, they are also among the top 10 or 15 diseases. Globally, this picture shows that communicable disease, that pie is shrinking, whereas non-communicable disease are becoming major cause of death. Roughly 2/3 of the deaths today, even the premature deaths, which we define as deaths below the age of 70 years, non-communicable disease are predominant cause. And that is one important thing that we have to keep in mind even when dealing with pandemics, because the vulnerability for death is definitely related with what chronic disease the person has in mind. And you might have heard that the mortality trends due to COVID in India were mainly in those people who were elderly and who were having diseases like diabetes or heart disease or hypertension. So we have to keep these things in mind. Injuries more or less are constant in the last 3 decades. So here you can see the total number of deaths by cause. There's a rise in cardiovascular disease and cancers and to some extent respiratory disease, but mostly other diseases are under control now. Plateaus, you can see, even some are declining. If you look at death by age, then you can also see that proportion of people dying after the age of 70 is gradually increasing. So life expectancy was going on very well in most of the countries, including India, and therefore the deaths below 5 years or in adolescents, younger children was going down, but deaths in the older age is going up. Of course, everybody is likely to die ultimately. I mean, definitely going to die ultimately, but if they die of NCTs after the age of 70, 80, then you say that, yeah, this is ultimately going to happen. So this picture also shows that good progress was made in those 3 decades, particularly in reducing under 5 mortality. You can see virtually a very sharp decline from nearly 35% to around 10-12% in those 3-4 decades. Let's look at global scenario of COVID. So when this pandemic started, of course, I think it was declared pandemic a little late, maybe a couple of months of advance notification would have made quite a bit of difference. But I think by that time, because of travel being going on in a normal manner, the virus starting from China went to many countries, including India. And therefore, I personally feel we declared this pandemic a little late. But since then, the cumulative number is rising continuously. And the deaths are more or less static, but still, you can see a slowly rising curve. This is a cumulative figure, so don't get confused with this. So as of day before yesterday, we had more than 205 million, which means 20 crore confirmed cases across the globe, and around 4 million, which means about 40 lakhs dying due to COVID. These are reported cases, and many people question, particularly in developing countries where the data reporting system may not be extremely good, whether this number is the actual one. But we feel that at least for deaths, the number look more or less not very different, because even in the rural areas where the pandemic reached late in India, people who fell sick and who were severely sick, they did come to hospitals. So while the reported cases could be low than the real figures, deaths were certainly not too much different. Still, we might have missed few. Because, for example, home deaths occurring, they might have never been reported. And people would say died of old age, but they would have, because our death certification of death program is still not 100% accurate. Another fact that we should realize is, the Sero survey that was recently done shows that roughly 60% of the population has already been infected in India. So, which shows that if we go by actual number of cases in India and extrapolate that 60%, which means more than 60-70 crore people have already been infected, where the reported is much less. Now, the reason behind this is, many of these cases, it could be even 2/3 of these cases, remain asymptomatic or very mild symptoms. They will never bother, and they will never have any fever or anything, and they will never come in the healthcare system. Why should they come? Because they don't know actually that they are sick. So these asymptomatic cases or mild cases become very important when we think about strategies for prevention. And that's why this is a positive sign. We call it in epidemiology the herd immunity. So when the herd immunity is already 50-60%, it's likely that the pandemic will taper down very quick. It's like a natural vaccination occurring. Look at the global vaccination scenario. Again, you can see the rising curve. At least for one doses, it is now quite good. More than 200 crore people have been vaccinated, at least one dose. In India, it's now 54 crores, which is a very good figure. But the fully immunized globally as well as in India is quite low. Perhaps vaccine hesitancy or some side effects occurring could be the reason, but people are now realizing the need for vaccination and coming in larger numbers. I think in India also the numbers are going up. Of course, the supply chain remains an issue, and as more and more agencies are supplying vaccines, this will also go away. But you can see that there is some discrepancy between developed and developing countries. The developed countries thought that tomorrow they may run short of vaccines, so why we should give it to other countries? Particularly Africa and some Asian countries have been very badly impacted because of poor supply of vaccine. India did a great thing by having indigenous vaccine and collaboration with the UK vaccine, and at least 2 of these vaccines being produced in large number in India. So that definitely helped reaching out to people. Some people criticize about prioritizing the healthcare personnel and elderly, but at that time the data that were clearly visible was that elderly had high mortality. So people, the decision makers and policy makers, they thought that it will be very important to cover them first. Obviously, the healthcare personnel became a very important priority, and I think this is a very correct strategy. Because if we lose more and more human resources who are giving healthcare, who is going to care for them? I salute the healthcare professional fraternity, which includes not only doctors but also nurses and other paramedics who stood by in spite of their colleagues being dying. They stood by. They have done a great job in controlling this particular pandemic. There have been questions about how India was able to, keep the mortality rate below 2%, whereas globally it rose, of course, to 7%, but now also it's between 2 to 3%. Again, we should not be very happy with this curve because some cases might have gone unnoticed, but still, I think after the second wave, of course, after the first wave for a large period of time, and then after this spike of second wave, where of course we had a lot of mortalities, but now deaths have been controlled quite significantly. So that's a good job that has been done in India. Why I wanted to show you the earlier slides in the beginning was to compare, all those things were going on from 19 to 22. You can see the straight curves, whether it is for HIV, AIDS, or injuries, or malaria. But COVID made a difference. And even now it's going on. So that changed the scenario of the burden of disease. Why this is important is, the healthcare system was adopted to treating those communicable and non-communicable diseases based on the prevalence and incidence of those diseases in those regions and countries and districts. So every system adopted to those things. When I say adopted to means doctors were trained to treat those diseases, the diagnostic facilities were available for those diseases, the drugs were made available, the projections that are made to government were based on the local prevalence data when they submit the plans at a national health mission. So for government sector, the drugs came based on the incidence and prevalence of those diseases. Private sector also was adopted to those things. But suddenly these spikes in the pandemic, they changed the whole scenario globally, not just in India, globally. And there was pressures on the health system. Even developed countries, let's talk about many European countries, including Italy, US. We do not know much about China, what was happening, but Russia and many other countries, South Africa, Brazil, India, some of the Southeast Asian countries, they all were, disrupted their routine system and was able to, provide beds to the sick people from COVID. Now that was that showed that our system was not tuned to not only treat the locally prevalent diseases, but also meet the pandemics or epidemics which are not forecasted based on the data that we have. So that shows that we have to be prepared for such pandemics in future, or even local outbreaks and epidemic in future, and keep the system ready for it. I mean, I can quote the example of what India has done for disasters, natural disasters like floods, like you have earthquakes or tsunamis, any big fires. The system is there to address those calamities immediately, because we have trained human resources. We had trained, even at district level, trained teams that are available, and you can just rush them. Currently, also in monsoon season, there were some floods in many places, and these teams immediately went there. Do we have similar setups under the healthcare system? The answer perhaps is no. Though, of course, I remember when I was in charge of integrated disease surveillance project started in 2003, and we made district response teams, but they were not trained enough to treat such pandemic situations, such situation where there will be spikes of cases and deaths. They were perhaps not able to cope up. So I think one lesson learned is that we should be prepared for any future pandemics or epidemics or smaller outbreaks of this nature, and respond to that immediately to reduce the burden as well as deaths due to these. Good thing also happened. For example, many countries adopted the non-pharmaceutical interventions. I think India was one of the leaders in that. Whether it was lockdowns, the first lockdown, the gradual relaxations, and second lockdown during second wave, schools were closed, people's movements were restricted, many religious functions were cancelled. So that was a very, very important measures that were taken. But if you see this global picture, number of countries that implemented such measures was in the range of ranging from 80 to 60%. So again, the lesson learned is that if one country has shown good example and effectiveness of such social non-pharmaceutical interventions, then they should be universally there. There was a very good compliance by some countries. This particular slide shows that people who did not go for social gatherings was close to 91%. Washing hands became 89 to 90%. I would have informed people about symptoms. Globally was 92%. I don't have a chart for India, but this was must be quite low in India, because people were afraid of going to hospitals. So even if they had symptoms, they were hesitant to, because tomorrow if they become positive, they knew that they will be quarantined. I don't know, I can't say people were wrong, because when they came to know that facilities in those quarantine centers at some places, not all, were not very good, so they were hesitancy to reveal the symptoms. Now this is bad from the epidemiology point of view, because if people have the virus, it could be mild or could be moderate symptoms, and they don't reveal, what will happen? They are going to spread the virus in their community. So that's why we have seen many families getting affected, because they did not reveal, and therefore they infected people living in the same household. There was a confusion about 1 meter or 2 meters social distancing. So that's why perhaps this was one factor that the adherence to this program was just 2/3. And many people did stay home, 78%. But of course, those labor class, poor people who had daily from, let's say, hawkers or laborers, it was very difficult for them to ask them to stay home. So that's why they are varying percentage of this. But I would say that, of course, it's too early to say what was the actual effectiveness of these social measures on the pandemic. But current evidence does suggest that this was very effective way of controlling the spread of the virus. There was difference definitely in the poor countries, those with poor socio-economic people versus the better ones, and you could see that the ability to pay for emergency crisis situations affected, and that's perhaps one reason why people were not. The deaths were more in the underdeveloped countries compared to the developed countries because of their ability to seek the services. Let's look at the healthcare system response. Recently, there was a publication in Journal of Health Management, and thanks to the authors for using this. But the healthcare system response, you can say, is broadly under these heads. Public health surveillance system for early detection and rapid response in terms of isolation was undertaken in most of the situations, and that was very positive way of controlling the epidemic. Implementing key public health measures like social distancing, frequent hand washing, respiratory hygiene, and using masks, and of course not attending many functions was also very important public health measure. I a little disagree with the word social distancing. I think we should use the word physical distancing, because social distancing means total isolation. People were calling on phone or videos or Skype or WhatsApp and talking to the people. So there was social connection in a different way. But what we told them, physically you don't meet, don't visit families, don't attend functions. So I would prefer the word physical distancing rather than social. Actually, we should encourage more of social interaction remotely to sort of reduce the mental aspects of this pandemic. Risk communication and community engagement was visible. You could see many communities coming forward in this and helping the poor, and also risk communication, telling the people about it through various media, whether it is television or radio or even the mid-media, to tell people about it. For example, I saw in my vicinity a vehicle going on when there was peak of the pandemic, telling people to remain indoors and things like that. That became very important because particularly the poor illiterate people were not aware about what's happening, but then they came to know through these media. Another good thing that happened was the healthcare system responded to the vulnerable, particularly those who had comorbidities and elderly. Healthcare system also responded very well to the surging cases by making a lot of innovations. You could have heard that many camps were organized, big temporary wards were built up very rapidly by many places. Some NGOs also did it. That was a very good way of increasing the bed capacity. Even railways came forward because trains were not running, and they temporarily converted these into virtually surveillance centers and even care centers. So this was another good way of innovating, and people thought out of box how we can meet the challenge. Unprecedented opportunities for transformational change. People's behavior changed, the way we work changed, the working from home changed. The money that is available with the governments, how they utilize those funds that were available and diverted a lot of funds from sectors which were not immediately required, can wait rather, and diverted to the healthcare system. This was a very positive, I think, political decision that was taken at the highest level. Even when the oxygen supply was running short, the industries which also use oxygen, those oxygens from industries were diverted for the medical care interventions. I would like to also see the positives and the negatives of this pandemic. On the positive side, the left box, you can see public health system has shown its potential during pandemic. People were criticizing about government healthcare system, which is generally called public healthcare system. But more than private sector, I salute the people who were in the public healthcare system. They responded very well to this pandemic. High risk exposure in hospitals led to a lot of casualty of doctors, more than 1,000 doctors having died as per latest reports, more than 900 dying in the second wave itself, and other human resources also. But their spirit didn't go down. I mean, in spite of colleagues being dying, and families also supported, doctor not going to the family um, for many weeks because they were totally, isolated even during non-hospital hours. Many private hotels, some of them were taken up by government, and the teams of doctors and nurses were living there rather than going home because the risk of transmission to their family members was high. Some even voluntarily gave these hospitals to the doctors for the welfare of these doctors. So there was a very good response by the communities, hotels, and other NGOs. I think from the positive side, people were criticizing governments after governments and comparing with the developed countries where they spend 8 to 10% of their GDP on health. In India, it was much lower than that, roughly 1.3 to 1.4% traditionally. Even the start of this particular plan, I think in 2019, the government decided to increase it to 2.5% gradually till 2024. But even 2.5% would not have sufficed. So I think for governments have to realize both at the state level and national level to provide more funds for healthcare sector as has been done in developed countries. You have to think of this investment. It will not return you in money terms. For example, when you are investing in a power sector or industries or agriculture, the output is also in terms of money. And that's why more and more money goes there. Here it will not be in terms of money, but it will be in terms of quality of life, in terms of extended life expectancy, which will also be, people who were able to earn more in those years. So you have to think of investment in health sector as a very, very cost benefit and cost effective, and invest more in this. I think government will definitely realize this in coming years. Another great thing that happened in India was use of indigenous vaccine. Believe me or not, there would have been more than double the need for money if we had to import vaccines, which were costlier. And this was a correct decision that was taken by the government to enthuse our scientists, our big organizations and pharma sector to go for manufacturing these vaccines. I think this could be written as one of the lowest period in which a effective vaccine was produced across the globe. It usually takes decades. You take the history of smallpox or polio or measles or other vaccines. It takes decades, and particularly reaching the developing countries would take even additional decades. In India also, it happened with routine immunization programs, and it took decades compared to the developed countries when they started using it. But in this case, good thing that happened was virtually very urgently produced local vaccine and giving it in big numbers. Social measures, testing, surveillance, quarantine, vaccination, this all put together saved lives. Some articles have already come how many lakhs of people might have died if we had not taken these measures. On the negative side, that was set back the treatment of persons with chronic disease and elderly. We knew about it, but we can't help it because these diabetes and hypertension and heart disease, as I showed in the initial slides, are going high, and many people are getting these. Even adolescents are getting type 2 diabetes, which at one point of time was called the adult type of diabetes happening after 30 years age. Now adolescents are getting it. Obesity, air pollution, unhealthy diet, fast foods, lack of physical activity, all those are reasons for this. So as the prevalence of these NCTs were high, that also was one reason. Thankfully, the government thought of this as a priority and immunized them earlier. Persons requiring emergency treatment for other conditions, they were not getting beds, stroke, myocardial infarction, asthma cases, where you require beds, in inpatient care, and the beds were not available. Either they had no option except to die at home, or go to costly private sector and pay huge amounts of money. So that was one of the setbacks of this pandemic. That's a high cost of treatment. Government would say, no, we don't have beds, so they refer to the private sector or divert them to the private sector. Low coverage for preventive services like immunization and nutritional supplementation, routine immunization, routine supplementation being given to under 5 children under ICDS or midday meals or other supplementary nutrients, adolescents also iron tablets, pregnant women getting iron folic acid tablets, routine immunization, they were all badly affected because the entire healthcare workforce was diverted for COVID pandemic response. Some studies have shown mental health issues also, mainly because of loss of job for the poor people. Working from home, we never faced be within the home for 24 hours a day for many, many months. It never happened. Closure of schools and colleges. So this all affected the mental health issues also. And earning of the people was badly affected. Added to that, the hesitancy and I would say some of the social media giving wrong messages, that also, had an apprehension to many people. And that led to vaccine hesitancy also, at least in the beginning. This is more or less a repeat of what I just mentioned. One or two points that's very important was the inhibition or fatigue of social measures, and that's one worry which is happening now. When the situation has improved in many states except Kerala or Maharashtra to some extent and some of the northeastern states, people think that now pandemic is gone. I just came from Indore today morning, and we saw people not using masks, going out in large numbers unnecessarily also. Now, this is a threatening situation. I think government has to use media again to tell them the pandemic is not gone, the second wave is still, the tail is still there, and the tail can become a head tail anytime. So we should not feel fatigued and at least continue to take social measures that were told during peak time. If a person was single earner and died, what happened to those families? God forbid. Many government is of course giving some ration, some free food for them, but how long? We have to think of rehabilitation of those families. Even now, don't wait for the pandemic to be over. Think of how best we can help such families. Some studies suggest that more people have gone below poverty line and unemployment has risen. There is some evidence to that also globally. In India particularly, we know that many people are below poverty line and people living in slums. Now, you are saying social distancing or physical distancing. Now, if you go to a slum, you will find one room hutment, 5 people sleeping at night. Measurement, 10 by 10 room. How can you think of physical distancing? Impossible. So such things were privileged for those who can afford. I mean, if we have 3 members, we have 3 bedrooms, we will be definitely ready to go in 3 different rooms during night. But what happens to those poor families? Massive migration that occurred during the peak waves was, everybody has seen those pictures and videos. It was a new learning for students who had access to internet to learn. The schooling was done through internet. But what about the poor people, in the rural people who do not have internet connections? Their studies were definitely affected. The cost of treatment, these are some of the estimates globally, and I have given the numbers in Indian rupees also. It will be beyond the means of common people. Some studies suggested that during peak wave between March to June 2020, during the first peak, the unemployment was very high, around 24%. We don't have figures for the second wave, but they will be almost similar, or maybe even more. Percentage of income also went down by virtually half for the poor families. You know about this, the GDPs of many countries were negative, including India. Good thing is India is recovering and recovering quite fast, but reaching the 7, 8, 9%, it may take another 1 to 2 years to reach those levels. But if you look at the global picture, except China, all other big developed countries, including US or UK or Germany or Italy or South Africa, Brazil, Russia, had negative growth. Question is how China managed it. I leave it to you. Long-term impact of COVID on the society. Schools were closed in almost all countries, 188, and 1.7 billion children globally, children, youth and their families were affected, and they were adopting learning process. India had a large population which depend on daily resources for food. They were badly affected. Disruption in the food system, because again, the supply chain system was almost diverted for vaccines and medicines and all. That was badly affected. And global estimates say that 71 million people were pushed below poverty line globally, as estimated by the World Bank. Negative economic growth. The good thing that happened in India's policy of self-reliance paying off. How much money we would have saved by using the indigenous resources rather than importing from outside. The general public has got the benefit of personal hygiene and other social measures. Even in the crowded places, they will use masks and other things. I think this practice has to continue beyond this pandemic period, because people should see the benefit of this. Washing hands with soap, for example. As I mentioned earlier, government seems committed to invest more in health sector, and this is across the globe also. Many technological innovations were made also, whether it was in oxygen supply, how we can divert industrial oxygen into hospital oxygen. Many new plants were set up quickly. Many information technology platforms were made available. Many apps came up which not only gave latest figures but also preventive measures. So this became important. Even government now is trying to use those apps for vaccination purpose also. This thing should continue. And in my meeting with the city authorities recently, a couple of days back, we were thinking about how healthcare system should be now fully using information technology for even general healthcare, not just for pandemic. So solutions have to be found out. There were a lot of pictures that were floating around how environment improvement took place. Even we studied this in many cities where we are working, and the pollution levels decreased significantly because of lockdown. That shows that these things are possible. And using the new technologies, information technology, that would be useful in future also. So I think, look, from the positive point of view, this pandemic has given us a lot of lessons to learn. how we can adopt those lessons in personal life, family life, how government should learn from these, how private sector should think of more investment in health sector, how corporate social responsibility funds should be diverted more for health sector rather than for any other sector. These are some of the takings from this pandemic. So on the Independence Day, let us look at this picture from a positive view of mind and see how we can improve our things in future, and challenge that may come in the future can be controlled quickly. Thank you very much.
Thank you so much, sir. Indeed, a very thorough and well presented talk. So, moving on, we have a couple of questions for you. Sir, could you, stop sharing the screen?
Yeah.
Yeah. So, on the top, so could you switch on the video?
Just
Yeah. Yes. Okay. So we have some questions for you. One of our doctors, Dr. Kuntal Biswas, wants to know how this mRNA virus is having so many mutations, and what are the important steps to be considered at a global level for that?
Yeah. I mean, look at the other pandemics that occurred earlier, about 100 years back. There were also mutations. But in those situations, the technology, the science was not developed enough to know more about those mutations. We do not actually know in the Spanish flu pandemic how many mutations took place. So one reason could be that perhaps now our science is so well developed that we can detect even minor mutations. That could be so. It may not be threatening, but good thing is even with these mutations, the vaccine efficacy so far, whatever mutations have occurred, most of the vaccines are effective, which means our effort for vaccinating people will not go waste. But when I compare with other viruses that recently happened, like Zika or SARS, there were less mutations. So that again poses a question: is it a man-made virus or is it a naturally occurring virus? Yeah.
Okay. So moving on, another question is, what measures should be taken on priority to revive the healthcare system across the globe?
I think we should invest more on this. So that is the first thing that we have to do. The government share of investing for healthcare development, healthcare sector development has to be multifold. I mean, even 2.5% of GDP in India would not suffice. I think we have to think of a bigger way. Another thing is in the mixed healthcare system which exists in India, we should find ways and means of how we can involve the so big private healthcare sector that we have. Globally also, the investments are likely to rise. But we have to also think of how within the available budget we can use that budget optimally. You know, we have some investment which may not be very cost effective. So you have to think of even whatever money is available, how best and where to invest most. That would be very critical. So I think our healthcare planners and managers globally, I would say. Secondly, I think you need to have a platform more powerful than WHO for more international collaboration. WHO is of course there since 1940s, but people were questioning its role in this particular pandemic, and that's why many countries had a bilateral arrangement. Also, even in India, you know, when they had this vaccine diplomacy, they had universally or unilaterally were going with Brazil and other countries, neighboring countries also. Some were given free, some were through a contract. So this should not have happened if there was a powerful coordination mechanism. So, you know, many developed countries, they didn't want to share vaccine with other countries, rich ones, because they thought that perhaps they will require booster also. So on one side, you are thinking of not only 2 doses, but also the third dose. On the other side, in Africa and many other poor countries, they didn't have even single dose. So we should think of more platforms and forum to strengthening international cooperation, not only in vaccine, but also in technological development, whether it's rapid test or other methods of diagnosis, other drugs or treatment. There should be more international collaboration.
So would you also like to talk about the efficacy and effectiveness of these vaccines when we're seeing so many mutations here, as per Dr. Kuntal's question?
We should keep continuous watch on this, because it should not happen that because of lack of data on effectiveness of these vaccines, we end up with another wave. So we have to not only identify new mutant, but as soon as you find a new mutant, you can definitely should do these efficacy tests, not only in laboratories but also in public, and think about how best we can prevent emergence of a virus, a mutant virus, which is not being controlled by vaccines. That would be disastrous. And also we have to think about how we can protect the young children and adolescents. Currently we are giving to adults. Now we are going to begin with the adolescents. But I think children would be more vulnerable. Once this virus becomes an endemic, then it may affect vulnerable population, which includes under 5 children, pregnant women, lactating women, and the elderly, and those with comorbidities. So we should think about the entire spectrum of population and not just adults.
Definitely, sir. Which brings me to another question. So, which countries have shown significantly better response against COVID-19 pandemic, and what policies have enabled them specifically to cope with the situation better than the rest of the world?
I would not point out any country that was able to successfully do this. Definitely not. Look at US or UK or Russia. Again, we don't know much what's happening in China, but unless we know the truth in China and whether they already knew about these variants and they were ready with the vaccine, we do not know much. But if you look at global data, you will definitely find China had one of very low burden of COVID, low number of deaths. So bigger country than India, and what happened there we do not know. Of course, the governance structure also matters. In India, it would be difficult to make mandatory social distancing or masking. There it could be possible. I can quote unofficially an example of Vietnam, where I am also working there. We could find very low burden and very low number of deaths. Of course, it's a very small country, but even if you compare the case fatality rate and the positivity rate of those people who were tested, it was very low. Again, it's a communist country. So in democratic countries, you have to think of making people aware and motivating them to adopt. In other government structures, whether it's anarchy or communism, you can force. So that may be one reason. But still, I will not name any country that was very successfully able to avert a second wave, which didn't happen. US is already going through perhaps a third wave. UK and many European countries third wave. So I cannot isolate anything, but this is another lesson that need to be studied. If some countries have shown good response and low fatality, what were the factors that were there?
So if not countries, but any specific policy that you would think that was, reinforced in one of the countries and that really turned out well in terms of the protection?
Well, those countries that knew the risk of entry of virus right in the beginning, when there was not a single case in India or in many countries, those countries which adopted the travel restriction policies, this was one criteria that perhaps helped. So loose policies that allowed people to travel from other countries which had infection, even India perhaps was faulting there. We rose very late during the pandemic and then controlled the travels. Because, this virus, at least in those times, was not able to transmit through airborne route.
Correct.
It was mainly through close contact with the diseased, coughing, sneezing, and all. So it could have been reduced if we had travel restrictions a little early. And that's why many countries now are thinking perhaps that was the correct policy. So you now find many countries, particularly like, let's say US or Canada and many other countries, they have restricted people from many countries, including India. So that's why, this could have helped. But when it became airborne, you can't, air doesn't require a visa to cross the borders.
Correct. That is correct. So also in terms of low and middle income countries, how do you think they have responded to the pandemic, and what are the learnings we see as a part of the entire 1.5 years that has happened?
I think many countries will not be in a position to produce vaccines of their own. So they had to depend on vaccines from outside. That would require international cooperation as well as funds. Every country produces, let's say 8 countries today are producing vaccine. First, they would like to complete their domestic need and then export. So what they have in hand is social distancing and other social measures, not vaccine. So travel restrictions, controlling people about, not going in crowds, social distancing, use of masks, all those were the measures which are free of cost for today. Very low cost, not free absolutely, but within their reach. Vaccine was the only thing which has to come from those big countries. So I think in that direction, at least, it's going to take years for this pandemic to totally taper off. So globally, we should think of how best we can supply vaccine to those poor countries. But till that time, they should adopt these more strictly.
Sure, sir. Also, will collaboration, again, I think you did mention about how collaboration is required between the international bodies. So do you think will collaboration between the international bodies like WHO, CDC, national government authorities, and of course, healthcare practitioners be benefiting in uplifting the entire healthcare system and the policy rules?
You see, one way is in emergency, you think of this collaboration. That is one way. I would call it a smaller way. Every country should now think of how best from their local resources or from global assistance. There are many donors. BMGF is there. UN bodies are there. Bilateral agencies are there. USAID, for example, or UK have their DFID. How those resources could be tapered towards building a resilient healthcare system, particularly for rural and urban poor communities. That would be required, and that's a long-term investment. It will not only help averting casualties during pandemics or small epidemics, but for the general healthcare also. Many people die of diseases where they should not have died. Why children should die of dehydration today? So there has to be a sustainable healthcare system to meet the local needs, including preparedness for such disasters in future. So they have to think about resources. Again, from where they should divert. If poor countries have very limited budget, even then they should think, invest at least 10% of their budgets, whatever they have, on healthcare. And consider this as investment for benefits, like not just money, but in terms of human development, quality of life. So if they see through that lens that this investment is not going to return in money, but in terms of longevity of people, quality of life, averting unnecessary deaths due to preventable diseases like diarrhea or respiratory infections or pneumonia or typhoid, then it's a saving. If a child doesn't die from diarrhea and lives for 70 years, how many productive years, at least 40 productive years he will give to the country. So if you think from that point of view, then the finance people and the policy makers and governments will think in terms of investing in the health sector. But if you think only as a sort of social investment or charitable investment, then GDP will remain 1-2%.
I think so. What you're trying to say is we have to look at the opportunity cost as well when it comes to
right. And long term, it's not going to benefit immediately in returns. Today, if I have 1 giga of agriculture and invest 100,000 rupees and you give me product of 200,000 rupees, I say 100,000. That will not happen with this long-term investment.
Correct. So one last question. I think it would be more like a twin question, how we can wrap this up. But what is the role of a healthcare professional in recouping the healthcare system, and also how can a community, like a layman, a community people, can participate in the preparedness against such future pandemics?
So for healthcare people, our main intervention has to be, whatever they have learned during this pandemic of protecting themselves first. They have to think of the precious value of a doctor or a nurse's life. So that should not be lost. The second thing for doctors is to skill development to meet such future challenges. It may not be COVID next time. It may come as a some non-communicable disease or some injuries. We do not know what's in our future, but definitely prepare themselves, update your skills every now and then, and attend CMEs or whatever. Many doctors do, but there is still no government policy of compulsory CME type of programs. Unlike in US, for example, your license is not forever. Here, if I get a license to practice, it's for almost now. Of course, there is a way of sort of renewing it, but there is no compulsion of me attending seminars or webinars and update my skills. That would be very helpful for the doctor, nurse, and other communities. From the layman point of view, the lessons that they have learned about personal hygiene, that would be very important. Today, it was a virus which goes through airborne or very close contact. Tomorrow, there may be virus that may be from water. So, personal hygiene across, not just respiratory hygiene, but also, hand washing, for example, frequently, before meals or after going to washrooms, how we can sort of wash our hands very thoroughly, our daily bathing and brushing and all those things, people consider very casually. I think the best thing for them is to see that, their personal hygiene and sanitary hygiene across the environment, home environment and community environment around improves. Government should also think of controlling, and making, water supply and sanitation and solid waste management, air pollution control as very important ingredients for a healthy life. So particularly urban poor communities, they may be worse off than rural communities, I can tell you that. And so we have to think of how best we can not only provide them personal skills for hygiene, within personal hygiene as well as within the family, but also consider, the neighborhood environment as their duty. If you are removing your solid waste from your house and throw it on the street, you are still at risk.
Correct.
So why there is still malaria and filaria and dengue? Because of vectors, and how the vectors were breeding from the stagnant waters. So these small things, if they can be adopted, healthy lifestyles, better environment, better hygiene. These are the keys for healthy life ahead of us. So that's the message for common citizens.
Thank you so much, sir, for such an excellent session. Any words of wisdom for our young doctors who are watching it in regards to your experience in working for a global population now?
The medical fraternity has done a great job. Let's keep our flag high. And there was one politician who was saying that I don't think our actors who are in films are heroes. The heroes are doctors. The heroines are nurses and other paramedic staff. And of course, the army and police and other, government officers who really dealt with this pandemic. Salute to all of them. And if we work together as teams, work for the welfare of the communities, then we can win any war. This was a very small thing.
Sure, sir. Thank you again. It was an honor to host you on Docplexus, sir. This is so much we can learn from experts like you. Also for our audience, thank you for joining us today and making the session more interactive and a learning platform for everyone. Thank you and have a great week, great evening ahead.
Thank you and happy Independence Day again to everybody.
Same to you, sir. Thank you so much.
Bye.